Hi, my name is Caitlin and I'm a registered dietitian here today to give you some suggestions for things that you can do about 2 weeks or so before your bariatric surgery. So one of the most important things when you are this close to your surgery is to really avoid that Last Supper type of mentality. It's common for people to really want to eat some of those favorite foods before you go into surgery. There's some fear sometimes just because people are worried they won't be able to enjoy some foods again. And that's really not true. You will be able to eat everything again, hopefully in moderation and obviously very mindfully as well. And for some people, it does take a certain amount of time before they can have some favorite foods again. But really, you do want to limit that Last Supper mentality because that can actually cause your liver to enlarge, which can in turn really make the surgery difficult for your surgeon to perform. So really being cautious there. Another suggestion is to get a tape measure and to measure around your chest, your waist, your hips, thighs. I've even had patients measure their arm circumference or their necks. It's nice to have this because as you go through this weight loss process, you will eventually go through weight loss stalls or plateaus. These are normal to expect during this process. It is extremely frustrating, but frequently when you are experiencing a stall on the scale, you will continue to lose inches or centimeters around different portions of your body. So those measurements can be really nice to look back on to help you stay motivated during some of those more difficult times. This is also a really good time to read through your pre-surgery instructions, double check, what medications you need to take, what medications you need to discontinue up until the day of surgery. It's also a good time to really focus on separating your liquids from your meals, so try not to drink with your meals. This is in part to help with satiety or to keep you feeling full after the surgery, but also because if you mix fluids and those solids from meals together after surgery, that can cause a real tolerance issue for some people. It can cause you to vomit. It can also cause the food to kind of swell and sort of bloat in your stomach, or it can sort of push the food through too quickly, which can cause you to feel really hungry afterwards, after a meal, or even worse, it can really make you feel uncomfortable. It can cause dumping syndrome. So really working on waiting that 30 minutes after a meal right now before surgery, before you begin drinking again. So I really look forward to helping you guys with any questions that you have, sharing some tips and suggestions that I've gained through the years. At any point really before your surgery or afterwards, if you have any questions, we are always here to help you with that. So our goal is to really help you have a safe surgery and successful outcomes. So please share, in the comment section below, what is your pre-surgery preparation like? What are some of those things that you're doing at home to get your body and your mind ready for this big day? Thanks.